Hi everyone, I'm Dr. Peter Salerno, retired licensed psychotherapist, personality disorder specialist, and featured expert in Hulu's Ted Bundy Dialogue with the Devil docuseries. In today's video, I am going to address three key issues: false accusations that I'm lying about DSM criteria, the problem when influencers misrepresent what the DSM means without proper training, and why it's unprofessional for influencers and clinicians to publicly disrespect others without direct dialogue. Normally, I wouldn't entertain or respond to public nonsense. However, when that public nonsense escalates to slander and defamation of character and false accusations, I have to address it, but I'm going to address it in a professional manner. Let's be crystal clear. The DSM, the Diagnostic and Statistical Manual of Mental Disorders, is a clinical tool, not a social media playbook. It requires training, nuance, and context to interpret accurately. You're not doing anyone a favor by spinning it for likes. The DSM is and always will be an evolving science. It's not intended for use outside the context of clinical research, diagnosis, and treatment. It's not a social media desk reference. And it's not dogma. It's not the Bible of psychology or psychiatry, and it doesn't claim to be, although many people misuse it that way. It's a practical manual for everyday professional work. Just to highlight how it can be wrong and has been wrong in the past, it wasn't long ago that homosexuality was classified as a mental disorder in the DSM. In the first DSM, it was listed under sociopathic personality disturbance as a sexual deviation. In 1968, it moved to sexual deviations alongside pedophilia. 1973, the APA voted to remove it as a disorder with a compromise: sexual orientation disturbance. In 1980, the DSM introduced ego-dystonic homosexuality, and then in 1987, homosexuality was no longer listed as any kind of disorder. Other examples of outdated and harmful diagnoses were also removed, including hysteria, present in DSM-1 and 2, removed for being sexist and unscientific. Masochistic personality disorder was drafted in the 1987 DSM, and it was a proposed personality disorder to describe people who repeatedly chose abusive relationships. It was removed after criticism that it was victim blaming, and it certainly should have been. The lesson here: the DSM is useful, but not infallible, and it will continue to change. Everything in it requires training, nuance, and professional responsibility to interpret properly. Now, disagreements among professionals are healthy. They actually advance our field. But what crosses the line is using condescension and attacking someone's character personally and publicly without seeking clarification. That is not professionalism, and it sets the wrong example for those we aim to serve. Here's where all of this started. I was interviewed in the past by a gentleman named Jared Mello. We were discussing the popular myth that all narcissists are secretly insecure. My statement said, most narcissists, in fact, are not insecure. I was accused of lying, fabricating research, and ignoring peer-reviewed research that disproves this claim. The individual who had an issue with this actually referred to me as a narcissist in a comment on one of my other posts all the way back in the beginning of last year, and basically stated, I'm a narcissist because I have suggested that there is a heritable component to narcissism based on the research I shared. He didn't ask me if he could see the research. He simply said, I seem like a narcissist because I'm sharing the research. This escalated to him publicly calling me a liar. So let's look at some peer-reviewed research so that I can explain why I said what I said. This comes from the Handbook of Trait Narcissism. Extant data suggests that vulnerable narcissism represents a construct that is largely divergent from NPD and grandiose narcissism. And why is it largely divergent? To finish the quote, it's composed of the tendency to experience a wide array of negative emotions, such as depression, self-consciousness, stress, anxiety, and urgency. So right here, these authors are differentiating between vulnerable narcissism and NPD, which is the DSM diagnosis. Further research demonstrates the following. I quote, "Grandiose narcissism is associated with grandiosity, entitlement, high self-esteem, interpersonal gregariousness, and assertiveness. This comes from the peer-reviewed journal, Personality Disorders, Theory, Research, and Treatment." And here's another article that is peer-reviewed. Grandiose narcissism showed a stronger association with NPD. So, what does this mean? The grandiose phenotype is the one most mapped onto DSM criteria for NPD. So when I said most narcissists are not insecure, did I lie? Not according to Johns Hopkins University research and other peer-reviewed sources from the Handbook of Trait Narcissism and the scholarly journal Personality Disorders, Theory, Research, and Treatment. Now that we got that out of the way, let's look deeper into vulnerable narcissism. Vulnerable narcissism is not a DSM-5 TR diagnosis. It's a research subtype marked by hypersensitivity, shame, and emotional instability. Let's look at the DSM-5 alternative model for personality disorders. In the DSM on pages 887 to 888, we see to diagnose NPD, we have moderate or greater impairment in personality functioning, manifested by characteristic difficulties in two or more of the following areas: identity, self-direction, empathy, intimacy, one of which references emotional regulation and mirrors fluctuations in self-esteem, but does not state that it has to be present, hence two or more, not this one always. The following personality traits have to be present, not can be or may be, have to be: grandiosity, feelings of entitlement, either overt or covert, firmly holding to the belief that one is better than others, and condescending toward others. Neuroscience has proven, look at the work of Lisa Feldman Barrett, we feel what we believe. We do not unconsciously feel the opposite of what we believe. In moments where I experience profound fear of criticism or rejection, I am not unconsciously brimming with confidence. If I believe I am in danger, I feel like I'm in danger. Similarly, if someone firmly holds the belief that they are better than others, as is the case with this necessary component of narcissism and NPD, not optional, necessary component, that means they feel superior, not inferior. They feel secure, not insecure. This does not mean that individuals who are narcissistic don't sometimes feel insecure or experience moments of shame. That's not what I'm saying. It means that insecurity and shame don't fuel the engine of narcissism. Grandiosity does, which is the opposite of inferiority and shame. Now we move on to associated specifiers. In the DSM, it says that traits of negative affectivity, including depressivity and anxiousness, can be specified to record more vulnerable presentations. These are associated features and specifiers, not criteria. Now here's where research on vulnerable narcissism gets really interesting. To me, it's interesting, so I like to share it. It's not controversial to me, it's just interesting. I would like everybody to please remember that this is not my research. It's the research of experts. I'm simply sharing it. Here's a quote from a peer-reviewed research article. Vulnerable narcissism was significantly associated with borderline personality disorder symptomatology, whereas grandiose narcissism aligned more with NPD. Further, Miller and colleagues concluded, quote, "Vulnerable narcissism is predominantly a disorder of neuroticism, marked by anxiety, depression, self-consciousness, and emotional instability." You know what is not a disorder of neuroticism? As we just saw in the alternative model or the dimensional model for personality disorders, neurotic traits were not listed as necessary criteria of narcissistic personality disorder. The trait that was listed as a necessary feature, the primary feature in fact, was grandiosity. Grandiosity falls under the domain of antagonism, not neuroticism. Additional findings include grandiose narcissism showed a stronger association with NPD, whereas vulnerable narcissism was only associated with BPD. A vulnerable narcissism composite score manifested a nearly identical pattern of correlations with general personality traits etiological variables, and criterion variables, as did a borderline PD composite. Nobody's making this up. Here's the synthesis. Vulnerable narcissism, according to research, mirrors BPD symptomatology much more than grandiose, dominance-oriented traits of classic NPD. Again, not lying, just sharing alternative perspectives that most people don't even know exist. This research clearly upsets a lot of people who cannot admit that they may have been wrong about a few things in the past, that believe old theories are set in stone and should not be touched in any way, shape, or form. I wonder if we should treat research on cancer or autism or dementia in the same way. Should we solely rely on research conducted in the early 1900s and mid-1900s to understand those conditions? Here is another big confusion related to narcissism. People equate narcissism with low self-esteem as if low self-esteem is the engine that drives narcissistic traits and tendencies. Here's another quote from a peer-reviewed research article published in the Handbook of Trait Narcissism volume. A growing body of research shows that narcissism and self-esteem are only weakly related because, quote, narcissism and self-esteem are rooted in distinct core beliefs. Going back to another source from earlier, grandiose narcissism is associated with grandiosity, entitlement, high self-esteem, interpersonal gregariousness, and assertiveness. And as I already mentioned earlier, the grandiose phenotype is the one most mapped on DSM criteria for NPD. So the one most mapped onto DSM criteria for NPD is the one that is associated with high self-esteem. Hence why I said most narcissists are not insecure and don't suffer from low self-esteem. This is why conflating low self-esteem with narcissism is a categorical error. Hopefully, people will now see that there is peer-reviewed research that exists that validates what I said in the interview. Now, this is something that I'm going to say that I'm sure is going to surprise a lot of people. Narcissism is weakly related to self-esteem in general, both high and low self-esteem. High self-esteem or low self-esteem, they are not the driving force of narcissism. Let's look more closely into the driving force of narcissism that is actually problematic. This comes from a peer-reviewed research article on narcissism. Narcissists believe they are inherently superior to their fellow humans. They hold exalted views of themselves, even if such views conflict with reality. One of the trainings that I attended over 10 times in my career that qualified me to become a certified personality disorder treatment provider and specialist was under Dr. Gregory Lester. Dr. Lester's private office served as one of the original research sites of the DSM-5 revision of the personality disorder section. Here is what he has to say about narcissists in his training. The problem with narcissists is even when they are not good at something, they still think they are wonderful. Their problem is grandiosity. It's not low self-esteem, it's inappropriate, misapplied self-confidence. This is a nuance that really needs to be understood, and this is why professionals need to be trained by professionals who know what they're talking about. It's not whether or not narcissists feel low self-esteem, fragile self-esteem, or even have high self-esteem. The problem is they hold themselves in high regard even when there's evidence contrary to that. They think the world of themselves even when they can't back it up. It's an unearned, undeserved self-confidence that they feel entitled to even when they can't back it up. That's the problem. It's that grandiosity that causes problems in the lives of others. It's not their self-esteem. If low self-esteem and self-doubt are what plague narcissists, they would be easy to deal with. Low self-esteem and self-doubt are not the kind of interpersonal dynamics that cause so much pain in the lives of others. Lots of people live with low self-esteem and self-doubt and never cause the kinds of problems that narcissists do because they don't antagonize others the way narcissists do. Trauma victims, by contrast, can maintain good character and kindness, even while carrying profound shame and low self-esteem. This shows us that self-esteem, even if it's experienced as fragile or low at times, is not the problem. The real problem, the engine of narcissism, is grandiosity. Consider this comparison. Low self-esteem, sensitivity to criticism, and feelings of inferiority are core features of avoidant personality disorder. So why don't we just call narcissists avoidants instead? Because their presentation is fundamentally different. Avoidants are not antagonistic. If they were, they would be just as difficult as narcissists to deal with. The DSM spells out this distinction clearly. With narcissistic personality disorder, some individuals with narcissistic personality disorder intentionally and purposefully take advantage of others emotionally, socially, intellectually, and financially for their own purposes and gains. With avoidant personality disorder, the low self-esteem and hypersensitivity to rejection are associated with restricted interpersonal contacts. I'm not comparing which disorder is worse. I'm simply pointing out that the engine driving narcissism, even when self-esteem is fragile, is grandiosity, and that is what leads to the mistreatment of others. With avoidant personality disorder, low self-esteem leads to withdrawal and avoidance. Grandiosity in the narcissist, rooted in antagonism, leads to exploitation. This is why self-esteem is not the issue. We can harp on it and argue about it all day long, but the reality is some narcissists experience high self-esteem, some narcissists experience low self-esteem, some narcissists experience fluctuations, some narcissists experience fragile self-esteem. Guess what? So do individuals with avoidant personality disorder, so do individuals with depression, so do individuals with anxiety, so do individuals who have no mental disorders whatsoever. Self-esteem fluctuates in life, but it's not the driving force that makes narcissists problematic. Now, this is going to be one of my favorite sections of this video. I hope you enjoy this. I get a lot of people throwing the term peer-reviewed in my face as if I didn't earn a doctorate in psychology and I don't know what the hell peer-reviewed research means. Here's what I found out. Most critics of me do not have a clue what peer-reviewed actually means. So I hope they are listening because now I'm going to explain it the way you would understand it if you went to school. Where is the peer-reviewed research? I have peer-reviewed research that shows you don't know what you're talking about. I get these comments a lot. As you can see in this video, I have already demonstrated that I do in fact have peer-reviewed research to support my claims. But let's define what peer-reviewed actually means. Peer review is the process by which an academic journal sends a submitted manuscript to other scholars in the same field to evaluate its clarity, logic, citations, and adherence to the journal's standards. If it passes, it's published. If not, it's rejected or revised. That process matters. It helps filter out poorly written or unsupported work. But here's the nuance. Peer review only means that the paper met the editorial standards of the journal. Many theoretical papers are peer-reviewed, but their claims have not held up to empirical testing. Entire schools of psychoanalytic theory once dominated journals. Melanie Klein, Margaret Mahler, Donald Winnicott, Ronald Fairbairn, Heinz Kohut, Otto Kernberg. Their work is cited as if it is evidence, but in reality, much of it was opinion and speculation built upon the assumption that we already knew all the causes of psychopathology. In reality, it was correlation without causation. Peer reviewing a research article is not the same thing as saying that it is true and accurate. Peer-reviewed research does not make something true. To make something true or accurate, it needs to be based on controlled studies that can be replicated and verified. A couple examples of these: genetic twin studies, neurobiological imaging, longitudinal designs, and quantitative analyses. These controlled methods generate data that can be tested again and again, not simply asserted subjectively. In other words, peer review is just a gateway to publication. It's not synonymous with truth. Empirical replication is the gateway to truth. You can't just say it's peer-reviewed and call it a day. It has to be empirically replicated objectively for validity. So when my critics argue that there's no peer-reviewed research, not only are they factually wrong, they are misusing the term. The studies I reference come from the APA and other empirical journals. They meet the gold standard of science, evidence that is testable, replicable, and falsifiable, and that are peer-reviewed. A layperson who thinks that peer review is synonymous with truth is not properly educated or informed. Now let's look at something else that's very interesting about diagnoses like NPD. NPD is a heterogeneous diagnosis. NPD's diagnosis in the DSM-5 and DSM-5-TR requires only 5 of 9 possible criteria, producing vast heterogeneity. One way to look at heterogeneity is through the combinations. There are 256 possible ways to meet the threshold. We also have something called phenotypic heterogeneity. Traits vary. Some emphasize grandiosity, others vulnerability. So mathematically, there are 256 possible combinations. These cluster into 126 distinct profiles. Some resemble vulnerable presentations, others grandiose. Let's go to the DSM-5-TR, page 761, which gets quoted often to somehow show that I have no idea what I'm talking about. Individuals with this disorder, NPD, require excessive admiration. Their self-esteem is almost invariably fragile, and their struggle with severe internal self-doubt, self-criticism, and emptiness results in their need to actively seek others' admiration. Wonderful. Here's the crucial point. That description is one criterion, but it is not required because only 5 of the 9 criteria are necessary. A person can be diagnosed with NPD without ever showing fragile self-esteem, self-doubt, or excessive admiration seeking. One patient may present with arrogance, entitlement, and exploitation without insecurity, while another may present with hypersensitivity and withdrawal. Both still qualify for the same diagnosis. The key takeaway is that not every patient with NPD looks the same. Heterogeneity complicates diagnosis. There can also be overlap with other personality disorders, and so interpreting NPD requires the capacity for nuance. As I've shared research earlier in this video, the grandiose phenotype is the one most mapped onto DSM criteria for NPD, and the grandiose phenotype is the one that's associated with grandiosity, entitlement, high self-esteem, interpersonal gregariousness, and assertiveness. The reason why the peer-reviewed research that insists that shame and low self-esteem and insecurity are the driving forces of narcissistic personality disorder, the reason why those theories are so problematic is because there are so many exceptions to them. But instead of acknowledging the exceptions, they simply say, well, we already know everything we need to know. And so if anybody else researches anything else, they're wrong, period. That is not any way to conduct research. As I stated earlier, recently I was publicly defamed by a lay person who goes by the name of Batwolf on Instagram. He stitched a video of an interview with me with a video of Dr. Mark Ettinson to label me a liar. He claimed I fabricated research, which I just demonstrated I did not. I want to touch quickly on Dr. Mark Ettinson. While we may disagree on certain points, he is a licensed professional. I also am a licensed professional. Professionals can and do disagree. That's how scholarship advances, actually. But lay antagonists like Batwolf exploit these disagreements to justify hostility, defamation, and harassment. Pairing my remarks with another clinician in a video, the way Batwolf did, actually showcases my point. Professionals can disagree thoughtfully. His attempt at jabbing and defaming me just highlighted who the professional actually is. False accusations like this highlight a very important lesson. Disagreement is healthy. Antagonistic, impulsive misrepresentation is not. It's slander and defamation of character. And all of this could have been prevented if he just had the decency to reach out to me and politely request my peer-reviewed research. I have consistently been accused of being a reductionist, a determinist, and the reality is people take a 1-minute clip of a particular thing I said, they completely ignore nuance, they completely ignore the gray area, they don't have the capacity to do anything other than dichotomize. And when they do that, they run the risk of falsely accusing me, getting reactive for no reason, instead of just clarifying things politely and respectfully. If you read my book, you will see that I am not a reductionist or a determinist. I'm not an environmental determinist, and I'm not a biological determinist. I'm somebody who is looking to bridge the gap between science and clinical practice. I'm somebody who is interested in bridging the gap related to exceptions to these rules in research that people ignore or dismiss due to confirmation bias rather than looking at the reality. We don't know everything we're ever going to need to know, so we need to keep doing more research to fill in the gaps. I like that. To me, that's the responsible thing to do. You can hate my presentation, you can hate the way I look, you can hate my tone of voice, whatever it is that you want to hate, go ahead. Those are your opinions, those are your experiences, no problem there. But when you falsely accuse me of making stuff up that is as serious as the disorders in the DSM, when you falsely accuse me of making stuff up about that, that's where I draw the line. Thank you for watching.